Hello, and thank you for the introduction. As Helene mentioned, we both work for Health Education England, which supports the delivery of excellent healthcare and health improvement to patients and the public of England by ensuring that the workforce of today and tomorrow have the right numbers, skills, values and behaviours at the right time and in the right place. Part of this work involves the stewardship of over 184 NHS library knowledge services across England, with a total of 626 qualified library and knowledge specialist staff. My role as part of a small national team is to provide strategic oversight and direction for teams based across London and Kent, Surrey, Sussex. Working with Alison, I also lead on developing and implementing Knowledge for Healthcare, a development framework for NHS library and knowledge services, which is a focus upon knowledge management.
So good morning. I wanted to start our session by sharing with you this photo taken in late April. This is really about why we do what we do. This is a guard of honour for Covid-19 survivor Stephen Parker, leaving after 35 days in intensive care at Poole Hospital to continue his recovery on a normal ward. Each one of the people in this photo benefits from the knowledge management services we provide. We ensure that they have the evidence and knowledge they require to inform healthcare decisions. Our scope is broad. We will talk about a variety of knowledge management initiatives, but also about evidence, by which we primarily mean published research evidence. Our aim is as important during this crisis as it was before March 2020. That the 1 million decisions taken each day in the health service are informed by evidence and knowledge to enable excellent healthcare and improved healthcare outcomes. The difference is the pace at which summaries of evidence and processes to share knowledge have been put into place. To mobilise the evidence relating to Covid-19, one of the first things we set up was some dedicated web pages signposting a range of evidence-based resources. This included establishing a Covid-19 search bank, which currently contains over 100 summarised searches of evidence, covering broad topics such as Covid-19 and children, to the very specific, such as how many masks are required per Covid-19 patient in a 24-hour period. The information within these has been used by those on the front line of healthcare to inform decisions. The National NHS Library and Knowledge Services team set up the repository of searches and rapid reviews which have been prepared by NHS librarians and knowledge specialists working across the country, but also linking to other collections of searches and search strings. This has facilitated the sharing of good quality searches and strategies, saving time and reducing duplication. A repository collating bulletins relating to Covid-19 prepared by NHS knowledge specialists has also been set up. This has fostered collaboration, helping to reduce the effort in preparing multiple bulletins across the country, and has enabled more topics to be covered than a single library and knowledge service could produce alone, ensuring that healthcare staff have the latest information. Collation of key, robust and reliable evidence resources that provide accurate information on Covid-19 have been pulled together in one place for ease of access to information professionals and to signpost to NHS staff, patients and the public. Sources include clinical decision support tools, including BMJ best practice, purchased centrally by HEE for use across the healthcare system in England. We have also collated resources specifically for patients and the public, signposting trusted online information that meets the former Department of Health information standard and aimed at specific groups of people, such as children and young people and older people, and over time will include information for patients with cancer, respiratory or immune suppressed conditions. This fills a gap in information already available on the internet. We have also maintained dialogue and negotiations with suppliers to ensure 24/7 access to the evidence base, including offers of free Covid-19 related resources during the pandemic. We've negotiated, for example, access to the well-renowned Royal Marsden Manual of Clinical and Cancer Nursing Procedures by Wiley, but also to make these available in such a way that they are easily discoverable by the routes most typically used by the NHS workforce in England. maintaining authorisation to digital systems and brokering arrangements with the British Library to offer the best possible support for the NHS at this time. This has involved prioritising requests from NICE and Public Health England, and then the NHS more generally, to ensure that documents are supplied that are required to inform the work around Covid-19. The work we are doing as library and knowledge professionals is getting recognition. This is an endorsement from the Chief Executive of Buckinghamshire Healthcare NHS Trust, who has valued the expertise of his NHS library and knowledge specialists during this time. Having specialist help to organise the huge amounts of changing clinical guidance and to effectively disseminate this and shared learning across the organisation has been invaluable. In addition, he says that the team of library and knowledge specialists have been instrumental in conducting research and finding evidence to inform the board's strategy on recovery.
To mobilise knowledge and know-how, knowledge specialists at a national, regional and local level have adopted a variety of approaches. The internal Health Education England knowledge management team have brought together mobilisation of knowledge and evidence in the service they've been providing. Specifically, they have contributed to the development and structure of the e-learning for healthcare technology enhanced learning team coronavirus programme, identifying and organising resources. They have responded to Covid-19 related inquiries and carried out research for HE staff, providing training and support for those new to using Microsoft Teams, and have supported staff resilience through holding virtual randomised coffee trials and facilitating virtual lunch and learns. Library and Knowledge Service teams have been involved in the setup of the Nightingale hospitals across the country, supporting training and development and ensuring access to the evidence base for staff. A community of practice was established to support the Library and Knowledge Services team involved in this work. This has helped to capture lessons learned about the setup in London that has helped to shape the offer elsewhere. This has included getting the BMJ Best Practice clinical support tool embedded into clinical workflows. Nationally, the Library and Knowledge Services team have been sharing approaches and disseminating information on evidence and the technology enhanced learning offer via NHS library leads with colleagues in Wales, Scotland, Northern Ireland and the Republic of Ireland, Europe and internationally. The team are putting people in contact with other people who can help each other, plus keeping in regular contact with colleagues at the Public Health England Information Service and disseminating the Public Health England coronavirus information page. At a local NHS trust level, some library knowledge specialists are supporting Trust Gold command centres. These coordinate on the ground responses to Covid-19 during each shift, ensuring swift, centralised decision making and cascade of messages. Roles for knowledge specialists have included logging decisions, tracking and analysing and categorising information flows. Production of daily summaries of policy and advice is another key task for us at this time. These are then used by colleagues manning telephone support for staff, for example, informing human resources question and answers. Supporting well-being has been key. Many local services are offering virtual services using Microsoft Teams to provide training to find the evidence, critical appraisal of evidence, or facilitating events. NHS Digital enabled access to Microsoft Teams across the NHS in March. Some services continue to offer a face-to-face service with library spaces conforming to social distancing rules and promoted as safe havens for staff well-being away from the busy frontline services, working with organisational development colleagues offering space for staff that need to self-isolate, wobble rooms or for staff counselling. Particularly during this time, ensuring excellent communication and ensuring shared understanding between patients and clinicians is critical. And so we've raised awareness of the health literacy e-learning modules launched earlier this year and developed in partnership with National Education for Scotland and the internal public health team at Health Education England. These raise awareness of health literacy and its impact, ensuring everyone has enough knowledge and understanding, skills and confidence to use health information, to be the active partners in their care and to navigate health and social care systems. We know that as we progress through this pandemic, the need to capture and put to use the learning is vitally important. Some healthcare teams are already actively gathering lessons learned and applying the learning from elsewhere. To encourage the use of simple techniques to capture and use lessons learned, Health Education England prepared a short video presentation talking people through the before and after action review and retrospect techniques. The challenge, however, remains on rapidly getting this learning into practice in organisations across the country, whilst continuing to capture learning as the ever-changing situation continues. A large part of the National Health Education England team is to provide advice and support to the Library Knowledge Service workforce on the ground, based in NHS hospitals, mental health trusts, commissioning organisations and practices. This has escalated since March, with regional leads establishing a picture of the varied provision available around the country. Most are offering fully virtual services, operating either from home or offering a skeleton staff presence in the workplace. Some have offered to be redeployed and are using their specialist skills to support coordination of accommodation, recruitment and training. The national team have responded to requests to support their workforce, sharing tips on well-being, working from home and running a virtual service, pulling specific resources together, for example on staff resilience, maintaining regular contact with individuals and facilitating wider group discussions, sharing opportunities to connect and learn, highlighting materials on the learning zone. They are also responding to requests, e.g. producing the video and effectively capturing and sharing lessons learned, developing guidance and sharing best practice on returning into the workplace and maintaining social distancing, linking people and experience together, so making the case against total redeployment and stressing the need to retain an information service at this critical time. Despite not having pre-planned for an event on this scale, we have proved that our established ways of working and principle of digital by default enabled rapid transformation to a fully virtual service. Identifying a central team to coordinate effort and collate resources saves duplication and effort. Regular opportunities to discuss and share approaches are hugely beneficial for teams that need reassurance that they are doing the right thing. Library spaces can be easily adapted to support staff well-being initiatives. Where services are already well established within organisations, they will be called upon to use their knowledge and information management skills and expertise to help senior leaders to make informed choices based on synthesised evidence. Applying our own knowledge management principles of sharing learning, connecting people and people to ideas, has helped at a local, national and international level to make the case about the value of knowledge management services and knowledge mobilisation tools and techniques in a period of crisis. Throughout this presentation, we've mentioned a lot of resources. So what we've done is we've summarised them on the slide here for future reference. That's all that we wanted to share about the position in healthcare. Do please ask any questions that you have. If you want further information, please don't hesitate to get in touch with either myself or Alison for more information. Thank you for listening.